3 Ottawa area children between the ages of 5 and 9 have died this month due to complications of influenza. This comes as health officials are warning of a rapid and significant rise in cases. Ottawa Public Health Medical Officer of Health, Dr. Trevor Arneson, joins us this morning with some more details. Good morning to you.
Good morning.
So I think it's important that we first establish these tragic cases that we've seen here in the capital. What can you tell us about what we've seen with those?
Yeah, so they are very sad. We learned of these just recently, and this is coinciding with a rise in hospitalizations and people testing positive for flu at CHEO. But yes, we've heard about three cases in children 5 to 9. All had influenza A, and we think that was the related to their death.
And how severe is that strain this year? Are you seeing it as opposed to past years where it has a little bit more strength and we're seeing these tragic cases?
Certainly what we're seeing with the early rise of flu and the rapid rise of flu is concerning for this flu season. I mean, we have different strains of flu every year, and we have multiple strains of flu every year. Whatever's happening right now is a very large spread of one strain for sure that is causing a lot of serious illness, especially in kids, which is concerning.
And those deaths that we've seen, we don't have the vaccination status on them as of yet, but how important is it to have those vaccines, especially when you see a rise in cases like this?
Yeah, so that's the most important message. The flu vaccine is the best protective measure against flu. There's been a lot of talk about its effectiveness against various strains, but we don't know that until later into the season. The important thing to know is even if a flu strain isn't a perfect match to the vaccine, there's protection against other strains, and there could be protection against severe illness. And that's really what we're concerned about is serious illness causing hospitalizations from complications, or in the worst case, tragically, the deaths that we've seen.
At what point, if it's you, a family member, or your child, should you start to seek some care if you start noticing some things that are going on?
Yeah, I think flu is a respiratory virus. I think if people are seeing real distressed breathing, lips or other things turning blue, these are really concerning things that you need to seek medical attention urgently. Other things like if a child's not waking up very well, like seems to be falling back to sleep or losing consciousness, or not eating and drinking at all for a prolonged period. Those are other times you want to seek medical care. But it can be challenging, and many of us are going to go through respiratory symptoms this year that mostly can be managed at home. And
you talked about vaccination status is obviously the number one thing you want to do to try to avoid the flu. But is there some other things that we can do in our lives to avoid potentially getting this strain?
Yeah, so I mean, it's really on all of us to try to limit the spread of flu. One of the big things that we can all do is if we are sick or we feel like we're coming down with a fever, is to stay at home, not go to work, especially or school, really especially not go to high-risk settings like hospitals, long-term care homes. Visiting elderly relatives over the holidays is really important. And then of course hand washing, covering our nose, mouth when we cough or sneeze, and then washing our hands, washing surfaces. These things do prevent the spread, and they do limit the number of people who are getting serious illness, and that'd be very helpful.
And what would be your last message to people that are maybe a little bit hesitant about getting that vaccine? Because I feel like that's the hitting home point that you're trying to make. So yeah. People that are kind of on the fence.
Yeah, I think there's a lot of misinformation out there about the vaccine. The vaccine certainly is not perfect every year, but it's our best protection. It does prevent serious illness in many people, and the side effects of the vaccine are minimal that we see. It's not a live virus vaccine. It's a vaccine with a very good safety profile, and we encourage everyone over 6 months of age to get it this year.
Dr. Trevor Arneson, we really appreciate your time, especially when we see these tragic cases like that, and hopefully to get that message out there this holiday season.
Thanks.